Alison, Associate Teaching Professor of Equine Ambulatory and Internal Medicine at the University of Missouri.
Hey, I'm Dave Recker, the mule enthusiast, and I'm here with Dr. Alison, and we're here at the Midwest Mule Fest, and she's already done 7 or 8 mules this morning. Would you just tell us the importance of good dental work, keeping your mule or horse dental work up?
Yeah, I feel pretty strongly about this, having been in a lot of mouths now of different horses and mules. It's just like in humans where we think it's important to go to the dentist every 6 months to a year. It's really the same thing for our mules and our horses. Horses have a couple of, and mules have a couple of interesting things about them that make it even more especially important, but their teeth erupt throughout their entire lifetime. So they erupt about 5 millimeters a year and wear down as they chew from side to side. They wear their teeth down and then they continue to erupt. So they have inches and inches of what we call reserve crown in there, and they sit up in their sinuses. And the most common cause of sinus disease in horses is tooth root problems. So it's really important if you have a long-standing sort of nasal discharge or malodorous discharge from a nose or a mouth that we start looking for dental problems. On a routine basis, they tend to get really sharp points, enamel points on the outside of their upper teeth and the inside of their lower teeth up against the tongue. And those points can actually cut into their cheeks, making it difficult for them to chew effectively. And what we see as owners is dropping feed, chewing abnormally, turning their head to the side, not eating well, and weight loss are some of the most common things that we see. And I just saw a 3-year-old filly the other day that had a huge tongue laceration just from her sharp enamel points, and
oh, wow.
That was for sure keeping her from eating effectively. She was having trouble gaining weight, so
wow.
We figured that was why. Some of the younger animals will have the sharpest points, and then there's kind of a sweet spot in the middle where they're 6 to 15, where usually just once a year annual exam is helpful.
Yeah.
So there's kind of like a little tube that comes from the tear duct. It goes down into the nostril, and sometimes that can get clogged and you'll see drainage coming out the eyes. So what she's going to do is she's going to put a little tube up the little hole, and sometimes they're hard to find, especially on mules and donkeys, and sometimes they may have more than one, and one will be a little false one. So what she'll do is she'll flush it up and it'll actually drain out here and clear the clog, and then you don't get as much eye drainage. Sometimes that helps with that.
Okay, great. They can bring them to the university, or
Yep.
you come out to their farm?
Both. So we travel farm to farm around the Columbia area, but if you have 5 or more horses, I'll come within a 2-hour radius of Columbia, and then certainly welcome to bring anything into the university, and we'll have our stocks and everything set up there that we can just do routine exams, we can do extractions and things like that.
Yeah. Well, I know I've had horses, and not only my mules, but I've had horses that had some of the problems you were talking about, and it was because I got lax on the dental work.
It'll correct a lot of those difficulty eating, head shaking, those sorts of problems, or even bitting issues when you're riding, like they're hard to the left, they don't want to bend, they're not softening, those sorts of subtle differences.
Yeah, mine was a bitting problem.
Issue, yeah.
And I wondered, why in the world is this mule doing this? And sure enough, it was a problem, a dental problem.
Right.
It was dental.
It's really not very affordable. Yeah, about just over, between $100 and $200 depending on what we need to do. So it's totally reasonable.
Yeah. Like going to our dentist.
Yep. Yeah, it's great.
Well, thanks so much for your time.
Yeah, thank you. I really appreciate
your
it.
Information, and we appreciate what you do there for the university.
I'm glad. Thanks for inviting me here today. This was really fun.
Okay. Thanks.
Yeah.
Okay.